You are listening to Module 2, Consumer Assistance under the Affordable Care Act, Training for Indiana Navigators. After reviewing this module, you will be able to correctly identify consumer assistants based on their roles, responsibilities, and requirements. You will also be able to comply with Indiana law regarding Indiana navigators and application organizations. You will know where to go for information about becoming a consumer assistant, and you will know how to direct consumers for additional information. Here you can see some other different types of consumer assistants who may help Hoosier consumers. Those include Indiana navigators, application organizations, authorized representatives, and health insurance agents and brokers. In addition to these state-recognized consumer assistants, there are also some other federally recognized names for consumer assistants that you may hear. The most common and likely titles for those federal consumer assistants are federal navigators and certified application counselors, or CACs. There are also other less common titles that you may hear, and some of those may be in-person assisters, certified application assisters, champions for coverage, and others. Federal navigators and certified application counselors have been certified by the federal marketplace to help consumers complete federal applications for health care coverage. In order to be certified, these individuals and organizations must meet the standards and requirements of the federal marketplace. They must complete training and pass certification examination. In addition to these standards, any individual or organization helping consumers complete a health coverage application, whether it's for the federal marketplace or Indiana Medicaid, must also meet Indiana standards and requirements for consumer assistance. This means that individuals helping consumers with health coverage applications must also complete Indiana Navigator certification, and any organizations must register with the state of Indiana as application organizations. With all of this talk around consumer assistance, many consumers may be left to wonder, am I allowed to complete an application on my own, or do I have to use an Indiana Navigator? The answer is that consumers do not have to use a consumer assistant in order to complete their application for health coverage. They may choose to apply on their own. If consumers do need or want to ask someone for help, there may be some things that they will want to know. With all of the different consumer assistance titles and certifications, it may be difficult for a consumer to know if he or she is dealing with a true Indiana navigator or licensed health insurance agent or broker. So the person may ask, once you have completed the Indiana Navigator certification process, it is perfectly fine to assure the consumer that you have been certified by the state of Indiana. If you are working with a consumer that is particularly concerned about sharing personal information with a stranger, you may also want to help calm their fears by showing your certification and helping the consumer verify your certification through the Indiana Department of Insurance website using the link on this slide. You should be willing to share your certification number with the consumer for his or her reference later if the individual would like it. The following section will cover Indiana navigators and application organizations, individuals and organizations authorized by the state of Indiana to help provide health coverage application assistance to consumers. In order to assure higher quality assistance and safety for consumers, Indiana lawmakers passed legislation to establish Indiana navigators and application organizations. This legislation introduced a required certification process for Indiana navigators and a registration process for application organizations. The role of Indiana navigators is to provide consumers with fair and accurate information about health coverage options. These individuals have been certified by the Indiana Department of Insurance to help consumers complete applications for the federal marketplace and applications for Indiana health coverage programs. Applications for the federal marketplace may include applications to enroll in a qualified health plan and to see if the consumer may be eligible for cost reduction programs like premium tax credits or cost-sharing reductions. The Indiana application for health coverage will check the consumer's eligibility for programs like Medicaid or the Healthy Indiana Plan. Individuals that work directly with consumers applying for the federal marketplace and Indiana health coverage programs should be certified as Indiana navigators. Some of the most likely entities to meet the definition of an Indiana navigator include federally funded, federally selected navigators, federally designated certified application counselors, Medicaid Enrollment Center staff or volunteers and staff of other organizations. There are some things that an Indiana navigator cannot do or cannot have on his or her criminal record if he or she wants to be certified. For example, if the person has ever had an insurance agent or broker license that has been denied, revoked, or suspended, then he or she cannot become an Indiana navigator. The same is true of an Indiana navigator or similar certification. If such a certification has been denied or revoked, the individual cannot be an Indiana navigator. In addition to these license and certification disqualifiers, the Commissioner of the Indiana Department of Insurance or the Secretary of the Family and Social Services Administration have the authority to say what is a disqualifying crime. For example, as Indiana navigators will handle sensitive personal information, it's necessary to protect the consumer, so a history of consumer fraud and abuse cannot be tolerated. This is why admitting or being convicted of unfair trade practices or fraud will prevent an individual from being certified. Here you can see the Indiana Navigator certification process from beginning to end. In order to become a certified navigator, all individuals must start with the Indiana Navigator application. After completing the application, you pay a non-refundable application fee. This fee may vary based on whether you live in Indiana or outside of Indiana. After you pay the fee, you will take a training course. After you complete the training, you will take the certification exam. Once you have completed the exam and receive a score of 70% or higher, you will be certified as an Indiana navigator. You will be certified to help consumers with their health coverage applications. Over the next year, you will be required to take continuing education so that you are aware of any changes and can give consumers the correct information. After 1 year, you will be required to renew your application and pay a new application fee. There are several different parts to the Indiana Navigator application. First, the Indiana Navigator must complete the application form. Next, the candidate must complete the criminal background check. There are a couple of different ways someone might meet this requirement. First, if the individual works for a registered application organization, that application organization may complete the criminal background check on behalf of the individual. If the application organization does not want to complete the criminal background check, or if the Indiana Navigator is not associated with a registered application organization, he or she can complete the criminal background check independently. The individual will simply need to go to the Indiana State Police and request a criminal background check be run. The results of the check should be sent to the Indiana Department of Insurance. In addition to the criminal background check, the Indiana Navigator must read and sign the Conflict of Interest policy. This policy details the relationships that someone may or may not have while serving as an Indiana Navigator. It is possible to have a conflict of interest and still serve as an Indiana navigator. If the individual has a conflict of interest, he or she will need to report that conflict of interest on the Conflict of Interest Disclosure Form. The individual will also need to report that conflict of interest to all consumers receiving assistance. In addition to conflicts, it is necessary to protect the privacy and security of the consumer's personal information. This is addressed in the Privacy and Security Agreement. All Indiana navigators will also need to read this agreement, sign it, and submit it with the application. Finally, all Indiana navigators must submit the non-refundable application fee. Once the fee is paid and all of the documents have been submitted, they will be reviewed by the Indiana Department of Insurance. All Indiana navigators are required to complete pre-certification training and a certification exam. In order to meet the training requirement, Indiana navigators must complete their training with a training entity that is authorized by the Indiana Department of Insurance. Once the individual has completed the training, the trainer will report it to the Indiana Department of Insurance. Authorized training entities may be found on the IDOI website. All Indiana navigators must also complete the certification exam with a score of 70% or higher. In order to take this exam, you must have completed the training with an Indiana Department of Insurance authorized trainer first. You may then log on to the IDOI website in order to register for a date and location to take the certification exam. Once the Indiana navigator has completed the application, training, and certification exam, he or she will be certified as an Indiana navigator. That certification will last for 1 year. 60 days before the certification ends, the Indiana Department of Insurance will send the Indiana navigator a reminder that it is time to renew his or her certification. This gives the individual 2 months to be sure that he or she has completed the 2 hours of required continuing education for an Indiana Department of Insurance authorized training entity, completed the renewal application, and submitted the non-refundable renewal fee. If the Indiana navigator forgets or cannot complete all 3 of these things before the certification expires, the Indiana navigator will have a 30-day grace period after his or her certification ends in order to get everything done. If the navigator completes the renewal on or before the grace period, there will be no need to retake the pre-certification training and certification exam. If the navigator does not complete the renewal by the end of the 30-day grace period, then he or she must start the application process all over, including the initial application, the forms, the criminal background check, the training, and the certification exam. Now, there is an additional fee for individuals completing the renewal during the grace period, so it would be best to be sure and complete the renewal before the 1-year certification ends. Application organizations are organizations with employees, volunteers, or both that are helping consumers complete applications for health coverage. Those applications may be with the federal marketplace for programs like qualified health plans or cost-lowering programs such as premium tax credits or cost-sharing reductions. They may also be helping consumers complete applications for Indiana health coverage programs like Medicaid, the Healthy Indiana Plan, or CHIP, the Children's Health Insurance Program. The requirements for application organizations mirror those for Indiana navigators. A representative of the application organization will need to complete the registration form. The representative will also need to review and sign the conflict of interest policy. If the organization has any of the relationships described in the conflict of interest policy, the representative must report those to the Indiana Department of Insurance through the conflict of interest disclosure form. Application organizations are also responsible for ensuring the privacy and security of consumer information, so the organization's representative will also be responsible for reviewing and signing the privacy and security agreement on behalf of the organization. Once all of these forms have been completed, the application organization will need to submit the non-refundable fee. Just as we saw with the Indiana navigators, The application organization does not need to be located in Indiana in order to be an Indiana-registered application organization. The fee the organization pays will be slightly different, but location does not prevent an organization from serving as an application organization. One feature that is unique to application organizations is that they will need to report all Indiana navigators working on their behalf. They will report Indiana navigators to the Indiana Department of Insurance and will keep an updated list by updating any changes within 30 days. There are some activities that application organizations are required to complete and others that are optional. When it comes to applications, application organizations must attest that all individual Indiana navigators working on their behalf are indeed eligible to be Indiana navigators, that they do not have a known criminal history or conflict of interest that would prevent them from being Indiana navigators. Application organizations must also pay a non-refundable fee. Options for the application process include the option to pay the application fee on behalf of an Indiana navigator. The application organizations may also choose to perform a criminal background check on all associated Indiana navigators. When it comes to training, application organizations must attest that Indiana navigators have all completed the required training, but they may choose to become training entities themselves, applying with the Indiana Department of Insurance to become authorized training entities. They may also choose to pay the training fees for their Indiana navigators so that navigators may receive training from another authorized training entity. Application organizations do not need to complete any certification examination, but may choose to pay the fee on behalf of their associated Indiana navigators. Finally, application organizations must renew their registration every year, just as Indiana navigators do. They must update their list of associated Indiana navigators to be sure it is accurate and up to date. They may choose whether or not they would like to become training entities authorized by the Indiana Department of Insurance to provide continuing education training. They may choose to pay outside organizations to provide continuing education to their authorized Indiana navigators. The following section addresses limitations for Indiana navigators and application organizations. Indiana navigators and application organizations must work in the best interest of the consumer by reviewing, agreeing, and adhering to state-specific standards, including conflict of interest, privacy and confidentiality, and conduct standards. One important and required part of the application for both Indiana navigators and application organizations is the conflict of interest policy. The conflict of interest policy defines the personal and business interests that may impact or influence the advice or assistance a navigator or application organization provides to a consumer. The conflict of interest policy breaks up those interests and relationships into two categories: prohibited and not prohibited. If the conflict is prohibited, the navigator or application organization cannot be certified. If the conflict of interest is not prohibited, the individual or organization must report the conflict to the Indiana Department of Insurance and any consumer he or she helps. The navigator or application organization must also complete the conflict of interest disclosure form. Indiana navigators and application organizations have specific rules regarding what they can and cannot accept from insurance companies. Things that they cannot accept include cash, paid commission, grants, credit or loans, gifts, or free or discounted travel or prizes. They may be able to accept goods or other advertisement with a value of less than $100 a year per insurance issuer. One very important conflict of interest is the financial conflict of interest. Not all financial conflicts of interest disqualify an individual or organization from serving as an Indiana navigator or application organization right away. On this table, we see financial conflicts split into three categories: direct financial incentives, indirect financial incentives, and no financial incentives. For the direct financial incentive, there is an example in which an insurance agent or broker receives commission from a health insurance company as compensation for enrolling somebody in a particular health plan. If an individual is getting a direct payment for only enrolling a person in one insurance company's plan, it's difficult to expect that person to provide complete information about all of the health insurance options that do not pay for help with enrollment. There's simply too much pressure to give biased information. The next example is an example of an indirect financial conflict of interest, in which an application organization representative holds stock in an insurance company. It may be to that representative's benefit to have consumers enroll in that insurance company's plan, but since that representative is not helping with plan enrollment directly, the conflict may not prevent the organization from being registered as an application organization. Decisions about what type of conflict is too much is up to the commissioner with the Indiana Department of Insurance. One final example of a financial interest that is not a conflict is for somebody that may be an hourly employee, making the same amount of money regardless of the number of people enrolled or the types of plans consumers select. Another type of conflict of interest is the conflict of loyalty. This happens when a business or family interest keeps a navigator or application organization from acting in the best interest of the consumer. One example could be where a navigator or application organization has a relationship with a hospital that prefers certain plans that have higher reimbursement rates. If such a conflict of loyalty exists, that conflict must be reported to the Indiana Department of Insurance through the Conflict of Interest Disclosure Form. It will also be necessary for any consumer or application organization to notify any consumers before helping them with an application. All Indiana navigators and application organizations must sign the Privacy and Security Agreement as a part of their initial application. When they sign, they agree that they will protect consumer information from reasonably anticipated threats. For example, they will make sure to pick up all documents with consumer information and not leave them lying out on a table in a public area. They will also agree to destroy information in a way that will make it unusable. For example, a navigator must be sure to shred all documents with a consumer's personal information should they be left behind. It is also necessary to provide only the minimum amount of information needed by an authorized individual or organization. For example, an Indiana navigator should only release the amount of information that is absolutely needed to complete the application, and to not provide a lot of extra information that the consumer happened to share with you as you were getting to know each other. Finally, the Privacy and Security Agreement promises that Indiana navigators and application organizations will not provide information to anyone unless the consumer or his or her authorized representative should request it. Family and friends may call and check in to ask about the consumer's application, but it is important that the navigator not say anything, as the information could be something that the consumer wants to keep private. In spite of the precautions, it is possible that personal information could be released. If that is the case, it is important to notify the consumer right away and to notify the Department of Insurance. When it comes to providing advice, it is important to realize that Indiana navigators and application organizations cannot provide specific plan selection advice. But those Indiana navigators and application organizations may provide consumers with general information that will help them make the best personal choice. On this slide, we see different types of plan advice the navigator may want to provide. It is important to keep from providing specific plan recommendations, but rather to give the consumer some general food for thought questions that can help with the individual selecting his or her own plan. Some of those more general recommendations may include helping a consumer to consider their healthcare use, how often they go to the doctor, and what types of doctors they may use. The consumer may also want help comparing plan benefits by looking at the summary of plan benefits for available health plans, or reviewing other consumer feedback posted on the Federal Marketplace website. The navigator may also help the consumer look at costs by helping them understand the premiums for each plan, and then based on their healthcare use, estimated co-payments and co-insurance costs that will go along with the different plans. Under no circumstance should the navigator ever directly recommend that a consumer enroll in a certain health coverage plan, saying something like, "You should really enroll in this plan." While there are a number of things that Indiana navigators and application organizations must do in their certification process, there are also things that they may not do. Some of those things include giving wrong or misleading information on the application or violating federal or state law. Additional prohibited actions are detailed in the following slide. To add to the prohibitions on the previous slide, Indiana navigators and application organizations are not allowed to misrepresent any insurance application or contract, nor are they allowed to cheat on a certification exam or to accept compensation from an insurance company for helping a consumer to enroll in a certain health plan. If an Indiana navigator or application organization should violate any of these prohibited items, or act in a way that otherwise merits a complaint, consumers may express their concern to the Indiana Department of Insurance. Incidents will then be processed and tracked through the Indiana Department of Insurance. Likewise, if a state agency has repeated issues with incomplete or inaccurate applications from a particular Indiana navigator or application organization, the state agency may also notify the Indiana Department of Insurance of the issue, leading to an investigation. When the Indiana Department of Insurance receives complaints about consumer assistance, it will investigate the issue. If the problem merits intervention, the Indiana Department of Insurance may take action. It has the authority to reprimand the Indiana navigator or application organization that is the subject of the complaint. It may also fine the individual or organization. If necessary, the Indiana Department of Insurance may suspend or revoke the certification or registration. If the Department of Insurance does decide to revoke the application, the Commissioner has the authority to say that the navigator or application organization cannot reapply for a set period of time, or, if the offense is particularly bad, the Commissioner may say that the person is never allowed to reapply as an Indiana navigator or application organization. Finally, the Indiana navigator or application organization may be subject to a cease and desist order, a legal statement telling them that they must stop helping consumers as an Indiana navigator or application organization. The intensity and severity of the enforcement action will depend on how severe the offense was, and any action will be at the discretion of the Indiana Department of Insurance. The following section will cover health insurance brokers and agents, consumer assistants that have been licensed by the Indiana Department of Insurance to help consumers enroll in health insurance coverage plans. Health insurance agents and brokers have been authorized to sell health insurance plans in Indiana. In order to receive this authorization, they must have a license from the Indiana Department of Insurance. They can get this license by completing the required training and certification examination. To act as health insurance agents and brokers, these consumer assistants must also sign an agreement with one or more health insurance company. That agreement authorizes the agent or broker to sell health insurance plans on behalf of that company. health insurance agents or brokers will receive commission directly from the health insurance company for each plan that they sell. If consumers would like to buy a health insurance plan through a licensed agent or broker, the consumer can find the contact information for local agents and brokers using a search function on the Indiana Department of Insurance website. Currently, health insurance agents and brokers sell health insurance plans on the existing health insurance market. Starting October 1st, 2013, agents and brokers may also choose to sell health insurance plans on the new federal marketplace. Any agents and brokers that do want to sell qualified health plans on the federal marketplace will not only be required to hold an active license from the Indiana Department of Insurance, but will also need to complete the federal registration, training, and certification exam before they will be allowed to sell those plans. Agents and brokers that have been licensed by Indiana and registered with the federal marketplace will be able to help consumers enroll in federal marketplace plans by either using the federal marketplace website or by using the insurance company website. Agents and brokers must inform consumers of the option to access the federal marketplace and federally qualified health plans. They can not only give the option to use a specific insurance company website. The following section covers authorized representatives, individuals that are authorized to act in the place of a consumer applying for health coverage. Authorized representatives are individuals that have been authorized by the consumer to act as the consumer. They may help the consumer complete the application for health care coverage and support ongoing coverage needs. In order to become an authorized representative, individuals may do one of two things. First, they may provide supporting legal documentation, such as an authorization as someone's power of attorney. Second, the consumer can complete the authorized representative form. For individuals applying to the state Medicaid agency for health coverage, the authorized representative form can be found on the Division of Family Resources website. For those using the federal marketplace application for health coverage, the authorized representative authorization is on the application. It is important to note that, although the authorized representative is helping a consumer with the application for health coverage, he or she does not necessarily need to be certified as an Indiana navigator. It is important that consumers really trust the individuals they choose as authorized representatives, as these consumer assistants have possible control over the application, eligibility, and ongoing coverage that the consumer has. The table on this slide shows the many different responsibilities for authorized representatives, whether they are authorized with a state application for health coverage or a federal one. The primary difference between state and federally authorized representatives is the consumer's ability to pick and choose the authorized representative's roles and responsibilities. Currently, the Medicaid authorized representative may be approved to do one or more of the items on this table, but the authorized representative that has been authorized for a consumer applying on the federal marketplace will automatically be approved for all of the roles and responsibilities listed. The following section discusses the ethics of serving as an Indiana navigator or application organization. There are ethical standards to which all Indiana navigators should adhere when they are helping consumers. As an Indiana navigator, you should be honest regarding any personal bias or conflict of interest. You should give complete and accurate information. You should admit when you do not know the answer. You should protect personal information for the people you are helping. You should be sensitive to different cultures, and you should use professional language. There are also some things that Indiana navigators should not do. As an Indiana navigator, you should not make up or guess an answer to a question, nor should you ask anyone more information than is absolutely necessary. You should not joke about sensitive physical, social, or cultural differences. You should not use derogatory or profane language toward or about a consumer. Put simply, no cursing and no putting others down. You should never be afraid to refer a consumer to anyone else if the consumer needs assistance outside of your scope as a navigator. It is also important to show commitment to consumers, which means listening to the consumer and working with him or her to determine the type of needs he or she has. It is also important to support a consumer's ability to make informed personal decisions. It is important for Indiana navigators to gain the consumer's informed consent, to make sure that the individual understands the navigator's role, what you can and cannot do. Make sure the consumer understands what the Indiana navigator can provide before getting started. Knowing the navigator responsibilities and limitations up front can help to avoid anger, frustration, and confusion later on. For example, you may want to let the consumer know that there will be personal questions asked as a part of the application process. This may keep the consumer from being upset when personal questions come up while you're filling out the application. It is also important that Indiana navigators remain competent and up to date on new information. There are still many changes to the Affordable Care Act, so it is important to know what those changes are and how they will impact consumers, and to know where to send a consumer for more information about those changes. Being competent is not about being able to explain everything about Medicaid or the Affordable Care Act, but rather the ability to understand what information the consumer needs in order to make informed decisions about things that directly impact the consumer. It is also important to show cultural competence and respect. Questions, languages, and priorities may vary based on a consumer's culture, and it is the responsibility of the Indiana navigator to work with the consumer to address his or her needs. As discussed previously in this presentation, it is also necessary to disclose any conflicts of interest to all consumers receiving help. Some conflicts of interest may seem obvious, but it is still necessary to report them, particularly for consumers that are unused to the complex world of healthcare. Privacy and security are also important parts of the ethical standards for Indiana navigators. It is important to keep a consumer's personal information private. Finally, it is important to use professional conduct whenever you are working with a consumer. It is important to recognize that many of the consumers requesting help have already faced many financial challenges to getting health coverage. They may also face additional challenges, including language or disability. In order to address these challenges, it is important that an Indiana navigator know about the resources that are available. For example, the Federal Marketplace call centers offer a language line for consumers that may need interpretation services in order to help apply for health coverage. The Federal Marketplace call center also has a line for the hearing impaired. The Federal Marketplace website is another resource for consumers that speak English or Spanish. More locally, the area agencies on aging have resources that can help consumers with disabilities. The same is true of the Division of Disability and Rehabilitative Services. Knowing that these resources exist can help Indiana navigators connect consumers to the resources they need. Consumers will undoubtedly come with a series of questions already in hand. While some of these are questions that an Indiana navigator may be able to answer, there may be others that are outside the scope of navigator training. It is completely appropriate to refer consumers with those questions to other individuals and organizations that are true authorities on those questions. For example, some consumers may not be worried about getting health coverage, but may be more concerned about what health coverage terms mean. In that case, it is important to direct the consumer to the health insurance company. Health insurance companies oftentimes have glossaries of commonly used terms, and these will help to explain the different health insurance concepts. Consumers may also have a number of questions about the Affordable Care Act and how it will impact them. In that case, it is important to remember that the Federal Marketplace call center is available for those consumers. It is also possible that a consumer already has a health insurance plan and is interested in knowing what services are covered by that plan. For those types of questions, it is important to direct the consumer to the health plan's summary of plan benefits. This summary will provide information on what benefits are covered, what out-of-pocket costs the consumer might expect to pay for different types of services, and possibly a physician locator to find out what healthcare providers have agreements in that particular insurance plan. As this document can be long and confusing, it may be helpful to recommend that the consumer talk to an employer's human resources or benefits manager with any questions that are not answered by the health plan's summary of benefits document. Finally, consumers may have questions about help selecting an insurance plan. Since Indiana navigators are not authorized to make recommendations on plan selection, it is important for you to direct a consumer to other resources. First, you may recommend the consumer look at plan quality information on the Federal Marketplace website. Also, the consumer may want to use a licensed health insurance agent or broker to select a plan. The consumer can find such a person by going to the Indiana Department of Insurance website and searching for Find an Agent or Broker. It is also important to address consumer concerns. Consumers may have a complaint about a consumer assistant. In this case, it is important to direct the consumer to the Indiana Department of Insurance, where they may file a formal complaint. Consumers may also have complaints about their health insurance plan. In this case, it is important that consumers start by contacting the health insurance plan itself to see if they can resolve the issue with the direct source. If they've tried this already and still cannot resolve the issue, then it is time to contact the Department of Insurance to file a complaint. The following slides will provide Indiana navigators and application organizations with resources for consumers and consumer assistance. This slide contains resources for where you can go to learn more about consumer assistance discussed in this presentation, including Indiana navigators, application organizations, insurance agents and brokers, and authorized representatives. This slide contains information on where you might be able to direct consumers for common concerns. This list of resources is not comprehensive, but provides a place for consumers to start. The Federal Marketplace Call Center and website will provide more information on federal programs, and the Indiana Department of Insurance will provide more information about Indiana navigators and application organizations, health insurance brokers and agents, and insurance-related information. Indiana's Family and Social Services Administration is over a number of different agencies that provide social services, such as the Area Agencies on Aging and Division of Disability and Rehabilitative Services. This concludes Module Number 2, Consumer Assistance and the Affordable Care Act. Now that you've completed this training module, you should be able to correctly identify consumer assistants based on their roles, responsibilities, and requirements, comply with Indiana law regarding Indiana navigators and application organizations, know where to go for information about becoming a consumer assistant, and know how to direct consumers for additional information.